serve on various boards and committees related to substance use.
Okay, great. I think we're just going to get right into it so that we have enough time for both the discussion and the questions. So go ahead, Tom, it's all you.
All right, let me do this fancy screen sharing thingy. Okay, can you guys see that okay? All right.
Yes.
Okay, so this a lot of this information is going to be somewhat repeat for some of you probably, and for other people everything is going to be completely brand new. So if you've heard some of this stuff before, just bear with me. The ORS tool, I am not the person who has access to the map. That is our data analysis. There we go. I was having a brain fart. Our data analyst has the actual map for the ORS tool, and so I give him the address for the OFR, and he runs it through there, and then he gives me a graph which I present to the OFR. And so we're going to talk about how to break that down, and so how we can present it and what information we're going to get from that ORS tool. So the first part is the data that we collect for the OFR. Demographics obviously is a big piece of the ORS tool. So separate to that, we have cause of death, drugs at the scene, death investigation, so on and so forth. But we mix those things with the demographics and the recent life stressors and healthcare access with that ORS tool, so we can start making connections for our decedent. And a lot of what we can identify with the ORS tool as far as recent life stressors and healthcare access, it fits very well into the ORS tool because it tells us kind of what's going on in their area of town that they live, as well as their history with substance use, trauma, criminal justice, mental health, social services, so on and so forth. So we pack all that information together. We run it through this ORS tool, which is presented prior to the case presentation. And then we start forming recommendations based on patterns that we see throughout that information. So this is an example of a timeline, and I'm going to kind of flip back and forth between this example timeline for John Doe and our ORS graph. But this example timeline shows a number of, can you guys see my mouse if I'm moving it? Okay, cool. Because I use it as a pointer. So it has a number of non-fatal overdoses throughout John Doe's life, a number of treatment, substance abuse treatment, and then dual treatment track, right? Pretrial supervision, dual treatment track, pretrial supervision again, and so on and so forth, right? So we're gonna look at this timeline with the ORS tool, and we're gonna be able to kind of link some of these things. So this is the first ORS infographic, and this is also does not actually belong to an individual. However, it is an actual area in the city of Hutchinson where I live. So the first thing that you want to look at when you're looking into this graph that I look at is the total population of this area of town is 7,408. So what you want to look at with this is your households below poverty level is 25%, so the quarter of all of them. Total households is 2,943, so that's obviously a far lower number than the 7,408. But you also have to account for couples with kids, things like that, right? Because each individual person counts in their population. But the average household size is 2.24. So if the average household size is 2.24, total households is 2,943, and total population is 7,000, we know that there's probably some unhoused individuals in this area. And so we take a look at that, and that gives us kind of an idea of maybe what's going on in that area of town, because we know with the unhoused population, there's going to be a higher crime rate, there's going to be higher substance use. And that's not to say, I don't want to push the narrative like unhoused people commit crimes, but unhoused people do what they have to do to be able to survive in harsh weather, harsh environments, and what they need to do to eat or get water or have air conditioning or whatever it is. So that's the thing that we have to take into account. With that, then we have to look at what kind of services are in that area. So that's another thing that we're going to look at on this graph. When you look at this area of town's education, okay, so the yellow dot is Reno County as a whole on average. The graph behind it is this specific area of town. So their grad professional degree and bachelor's degree is far lower than Reno County as an average. Their GED is a little bit higher, and their high school diploma is a little bit higher in this area of town. So education as a whole, primarily it's people that are graduating high school and not doing a whole lot more with their education. Their crime index is one of the primary things that I want to look at in a specific area of town, especially if the population of that area implies that there's a lot of unhoused individuals. You look at this crime index plus the median household income up here, $41,000 is pretty low. Households on food stamps or SNAP, 18%, almost 20. So that's a little higher than we'd like it to be. And then their housing affordability index is 214. I don't know if 214 is good or bad, but I know that compared to the next graph that we're going to look at is not a super expensive area of town. But there is a quarter of the households in this area are below the poverty level. So naturally the crime rate is going to be up. So if we look at the crime rate, motor vehicle theft is almost, not quite, but almost twice as much as it is in Reno County as a whole. Larceny is up. Burglary is much, much higher. Assault is much, much higher. And then robbery and rape are a little bit higher than the rest of Reno County, as is murder. So the crime index as a whole in this area of town is considerably high. And then you look at the no health insurance. So this kind of goes back to what kind of resources that people in a certain area of town can access. In this one, no health insurance from 0 to 18 is high, 19 to 34 is high, and then 35 to 64 is astronomical. So the people in this area of town, by and large, don't have insurance. And then it's also important to remember that Medicaid, Medicare, both of those things are insurance. So as a whole, not an insured area of town. You look at their income spent on rent and mortgage, it's pretty close to where it is with the rest of Reno County. And keep in mind, this is by percentage. So naturally, if the median household income is $41,655, those people are going to live in an area of town that they don't have to completely struggle in, or that they can afford, right? So usually income spent on rent and mortgage, that graph almost always looks like this in my experience, at least with Hutchinson. With Reno County, it does. Struggles with healthcare costs. The area of town that we're talking about is lower than Reno County as a whole for the most part. And I think the reason for that is because, judging by no health insurance by age, by this graph, and struggles with healthcare costs, I would suggest that these people don't go to the doctor very often. Then, so we look at Spanish-speaking population is relatively high. Spanish, English, spoken well is 2 to 4%, which is not a very high percentage, but as far as Spanish-speaking population goes, that's pretty high. So the next half of this graph is population by race or ethnicity. Non-Hispanic, so mostly white people, Hispanic people 18%, and then non-Hispanic or Black 7%. So mostly white people in this area, but they have a pretty high amount of Hispanic individuals. Internet access is pretty much on par with the rest of the county. But then another one that's really important to look at with ORS is the civic engagement. Because when it comes to substance use, mental health crisis, when it comes to financial issues, all of those things, civic engagement is where they're going to be able to network. They're going to get contacts that they need. They're going to access services. And this area of town engaged in fundraising, volunteering for things, served on committees or local organizations, attended public meetings, all of those are considerably down compared to the remainder of Reno County. So that means that this area of town, these people are just not connected. You go to the age pyramid, and for the most part, it's pretty on par with the county. Outside of from 25 to 29, going up to about 40 to 49 is a little bit higher in that area. So there's a drop between about 50 years old up to about 65. And then there's a lower amount of 65 and up in this area of town compared to the rest of Reno County. So then we can kind of draw the conclusion that a lot of the times, or a lot of the reason that you're not seeing Medicaid as an insurance in this area is because there's not a lot of elderly individuals living in this area of town. And then number of vehicles by household type is pretty on par with the county. Social media also. So that gives you kind of a breakdown of what we're looking at with the ORS tool. So I want you to keep in mind the civic engagement example, and then the crime index example, and then the population. So then we go look up at this, and with the example timeline, when it is a case that we're presenting to the OFR, the important question that we have to ask with using the timeline and the ORS tool is why, right? So John Doe has 6 non-fatal overdoses, well, 5 non-fatal and 1 fatal overdose in his timeline. So then you have to ask why, right? He's living in an area of town that has a high crime rate, so you can assume that it probably has a higher substance use rate. He's living in an area of town that is not connected to other people, really, because their civic engagement is so low. So they're also going to have higher mental health stressors. And another thing that we know too is if you have run-ins with criminal legal system, then you are at higher risk of overdose, because if you're sitting in jail, then your tolerance goes down. You get released from jail, you're at a high risk of an overdose. Same thing with if you're going to treatment. John Doe has a few different treatment stints on his timeline. And so that gives us kind of an idea those things are connected. Community corrections, court, stuff like that. Another important thing to remember as far as the ORS tool is how easy is it for John Doe to get to court? How easy is it for John Doe to get to treatment? Does he have a ride to those things? If he doesn't, is he motivated to show up? Is he motivated to show up on time, to call in when he needs to? Is he able to find steady employment? Like, so these are the questions that we have to ask with this. And that ORS tool, what it does is it tells us what services are needed in what area of town. Because there's, like I said, no civic engagement, there's no access to healthcare, there's so on and so forth, right? So we can identify some specific services that would be needed in that area of town, as well as that population is lower income as well. So then we go to the next one. This one, the population is a little bit more of an issue because their total population is almost double the last area of town. So, and again, this is not this does not belong to a real person, but it is a real area of Hutchinson. So 14,000 is their total population. Median household income is much the same as the last one. Housing affordability is a little bit lower in this one, so it's probably a cheaper place to live. 23% below poverty level, so that's still almost a quarter. A little bit lower than the last. Let me make sure I'm not going to eat some crow. Yeah, a little bit lower than the last graphic, but still almost a quarter. Total households, 5,689. So the gap between total households and the total population is massive, especially considering average household size is 2.22 people. Okay, so the amount of unhoused people in this area is going to kind of dwarf the amount of unhoused people in the previous area. So we can expect a higher crime rate. We can expect their poverty level to be higher, not necessarily higher than the last, but higher than it should be. And we can expect their civic engagement to probably be not equal to the remainder of Reno County. So, and that's without even looking at the graph. Then we look at the graph, their education is kind of the same concept as before. We have people getting GEDs or graduating high school, and they're not doing a whole lot more with their education as far as comparatively to Reno County. Their crime index is the same. Motor vehicle theft, larceny, burglary, assault, robbery, those things are up. Burglary and assault are up considerably. And then rape is on par, maybe a little bit lower than the rest of Reno County, and then murder is up. No health insurance, we're running into almost the same issue that we did with the previous location, where 19 to 34 and 35 to 64 are uninsured. And then 65, there's not a large population of those individuals. Income spent on rent and mortgage, struggles with healthcare costs, it's the same thing. They fall below with struggles of healthcare cost. Reno County, insinuating that they probably don't go to the doctor very often, so they're not accessing healthcare. And then their Spanish-speaking population is higher than the previous location too. So their Hispanic population is also higher in this area of town. It's this graph up here in the corner. Still largely made up of non-Hispanic white people, and then 7% non-Hispanic black. Internet access is about the same. Civic engagement, as we expected, is lower. So again, they're not accessing services that they need. They're not participating in social programs. They're not engaged. And it's the same thing with the age pyramid. Low population of elderly individuals on both sides, and then a higher population of people from the ages of about 20 to about 40, give or take. And the same thing with women. Vehicles by household and social media are pretty much on par, minus maybe Facebook. So, and that's the other thing as far as like civic engagement and social media use. Facebook is where a lot of people learn about social things that are happening at events, whether something is happening at the library, whether there's like a community potluck type of thing, that sort of thing. A lot of that information goes out on Facebook. So a good portion of people, at least in this area of town, that aren't using Facebook, that fall into this gap, are not getting that information, which is making them farther from civic engagement. So then we take that back up to the example timeline, and we're going to attach John Doe to this other area of town. It does kind of the same thing as the previous graph, which tells us, you know, there's a number of run-ins with the criminal legal system. There's a number of non-fatal overdoses. There's a number of treatment stents. So again, we have to ask why. You can follow the money on that one. There is an even larger number of unhoused individuals. The crime rate is up. Education. People are getting GEDs or dropping out of ninth grade or graduating high school, and they're not going very much farther with that. And so it gives us kind of an idea of what services are needed in that area of town. So just like the last one, mental health, healthcare as a whole, there's probably not, I would say there's probably not like a local gym even in there for people to have something to do that is going to be a little bit more healthy. There's no library that end of town, because those things kind of start to brew some civic engagement, and we're not seeing that in this area of town. So by that, we can start to say, okay, so what kind of services do we have in this area of town based on what we have with the ORS and what we have with the example timeline. So we need to get harm reduction services into that area of town. So like naloxone distribution, we need the saturation to be heavier in that area of town. We need to make sure that there's some sort of transportation access, whether we're handing out RCAT, which is the Reno County Area Transit, is the bus. If we're handing out RCAT tickets, or, you know, so if we're going to go and here last week we had an event for the unhoused where we did our own Hutchinson point in time count, where we offered haircuts and showers and a meal and stuff like that. That's pretty close to these two areas of town, because that's where we're going to see those numbers. And we're passing out harm reduction kits, wound care, burn care, naloxone, stuff like that. So that's where we're providing these services based on what we're seeing in our ORS tool, as far as where those services are going to be needed the most. I think that's pretty much the breakdown that I have for you. Does anybody have any questions on that?
I have a few questions, but I'll if anybody else has any.
Yeah, this was super. I mean, it is an awesome tool. I really appreciate the presentation. Would you be able to provide some information on how we or someone at our agency would be able to access the data? Because you mentioned that that kind of has to be a specified person.
Yeah. So there is with the ORS tool, anybody can get on it, and there's a like a kind of a blanket statement map that shows certain things in your community that anybody can access.
Oh,
But if you want that detailed information, then when you go into the initial page of that ORS tool, there will be a thing where you can request access or apply for access. I don't remember how it's worded, but once you do that, then theoretically, if you can get permission to access that, then you should be able to get. Let me look up and see if I can find the. Here we go. Um, I'm looking. I'm looking for the map because I figured it would probably help if I could just throw a link in the chat. Um,
if it does not need to be this moment, but like that would be definitely
yeah,
super
yeah,
helpful. If,
I
yeah,
can certainly get you the information, and I can have Indira email that out to you guys or something.
cool. Thank you so much for your time.
Yeah, absolutely.
I will include the link in the follow-up email, but I did drop the link for the ORS dashboard in the chat. So if you want to go ahead and access that, you can. It's also in the Illinois Resources Google Doc that I
Oh yeah.
gave you guys the link to. So it is there if you
Okay.
need it later on. Tom, I had a couple questions. Um, so I love the way you guys formatted the timeline as well. So what software are you guys using to develop that?
So that example timeline is not what it actually looks like when I present it to
Okay.
the OFR. It is done just on an Excel document, um,
Okay.
which probably I don't know, could be better, but I think it's effective on Excel because you can still color code everything. You can
Mm-hmm.
still space things out. Um, one of the things that I have noticed is with like with the timeline when I present that, what it actually looks like in the OFR, it'll have the date of birth, date of death, the age, and then I put on that timeline the toxicology information. And then after that, it just goes into um, let me see if I can actually just pull one up real quick. Um, it'll have the information for like if it was a medical or a law enforcement or social open court records. We use all of that for our um, timeline. I'll try and get one of those pulled up.
Thanks.
My internet's being remarkably slow. Does anybody have any other questions while I'm digging around for this thing?
I was just wondering if you had any examples for how this information or the data was used to like inform your recommendations or how it's changed the decision-making like brainstorming process when you have the discussions.
So one of the primary ways is kind of like I had alluded to on there was like naloxone distribution. One of the things we've noticed in a county like Reno is a lot of the people that are uh, passing away from overdose are living outside of the county seat, which is Hutchinson. So if they're living in one of those more rural areas of Reno County, there's lower access for things like naloxone. There's lower access to education. with like what substance use is, the neurological effects of substance use, especially prior to the age of 25 when your brain is fully developed, access to mental health resources, things like that. So what we are kind of working on with those is how we can get those resources to those more rural areas, because those are the ones that are lacking it the most. And so how we are pulling that from the OFRB, the OFR board, is we are we look at the OFR or the ORS tool prior to the case presentation. So the way that I do it is obituary, ORS tool, and then timeline, right? And I do that so first of all, so people can recognize that this is a person, this is a human. They have family, they have memories, they had a personality, they had yada yada yada, right? So you present a de-identified obituary, you look at that ORS tool, and you see the gaps in their income, in their housing. You see the unhoused population. You see the crime index, things like that. And so then you're linking together two things: is A, this is a person, and their family cared about them very much, or depending on the obituary, if it's very short, sweet, and to the point, maybe they didn't have a good relationship with their family, right? So then you look at the other information for the ORS, and you can say, okay, so this becomes why it's important. So this person is living in an area of town that doesn't have a lot of access to these like social aspects, because community is not only a survival tool, but community is a recovery tool. And if you don't have it, it's very hard to stay in recovery if you are isolated. So then from there, we start looking into what people at the OFRB, and that's where your recruitment comes into play, can work on getting naloxone to those areas, where we can get naloxone from, how we can partner with. A lot of the times it's DECA. I'm sure you guys are at least halfway familiar with DECA. So a lot of the times we get bulk naloxone from DECA, and we can then distribute it out from there. That ORS tool, along with OD map, is what we used to identify the area of town where we would need a naloxone vending machine. And now we have a vending machine where you can walk up to it and you can put in your zip code and it will give you naloxone for free. So DECA and Blue Cross Blue Shield helped us put that one into play, and they utilized the zip code information so that if we need a second machine going down the road, they'll have a pretty good idea of what end of town it needs to be on. So I don't know, does that answer your question?
Yes, it does.
Okay.
Thank you.
Mm-hmm.
Does anybody else have any other questions for Thomas? I did see that there was a question about signing up for the ArcGIS platform. So I'm going to be just dropping in a link. If you don't already have access, you can just create a free account, and then you should be able to use the website. And this meeting is recorded, so you guys can get the recording afterwards. I will send it with the follow-up email. Okay. All right, if that's it for questions, then thank you so much, Thomas. This has been so informational.
Mm-hmm.
And thank you for taking the time to come and speak with us.
Absolutely. Thanks for the opportunity.
Definitely. All right, well, if there's any updates from any of the counties that they'd like to share, I'd love to hear from you guys. Or if you're having any issues with troubleshooting, this is a good place to ask questions.
All right, so in DuPage, we have had a pretty busy quarter. we're turning over a good number of people on the team. Our project director here at the health department left for another opportunity, so we're kind of figuring that out at the same time. But we have we've gotten some good membership on our recommendations committee from people with lived experience, and I think it is both their experience and just their go get them attitude that has really driven a ton of good movement on our recommendations lately. So super happy about that. We have been trying to figure out uh, the red cap or like the data system project in a way that we haven't had a need to work on that quite yet, but we finally like have the means to do it. I don't know if we are going to be able to use RedCap the platform itself. And so my question was, if it looks like for whatever reason, like we can't get because they require you to sign up for like a data use agreement with RedCap itself, and I don't know if that is a deal breaker or not, but I'm kind of anticipating that it might be. Since we would only be using it internally, is there anything keeping us from building a super budget version of that where it's got all of the same fields in like an Excel document, and we're not even like the data entry is literally for case A going field by field and entering answers in that way so that we would be able to have a record of the cases that we review. It just wouldn't be going through like the official RedCap process.
Okay, so if I understand your question right, you're looking to store the data internally through Excel?
Yeah.
Okay, and you're looking for a template.
So I'm kind of creating my own, but I was curious, like, am I missing something that we'd be missing out on by not using RedCap itself, like the actual program that I I think the main thing that you miss out on is it doesn't generate a beautiful data entry page that like automatically in the way that it would if
Yeah,
we had RedCap. But
yeah.
is there anything else that I'm missing?
You can, there are a few resources in the OFR Google Doc. So one is the Data System User Guide from IIR. There are several data dictionaries that are Excel spreadsheet formatted already. So if you want to just copy paste some of the stuff from there, that might fill in the gaps if you're missing something. And that too, you could just, choose what sort of fields that you think you're going to be filling in more regularly. That way you don't have like a ton of fields that you don't necessarily need. The way IIR had formatted it was that you fill in the information that you have and you just leave the rest blank. So just take the cells or the fields that you think are going to be the most useful, and then you can just sort of, you know, fill in the gaps there.
Cool. Uh, I'm starting down that road and will provide an update if it ends up being worthwhile or a total waste of
Sure.
time. So yeah, but yeah, I hopefully, I mean, it would be great if we can do RedCap, but that is looking a little bit unlikely at this current moment.
Yeah. I do want to
Last,
mention, oh,
go
go
ahead.
ahead. No, please go ahead.
The Speaking of the resource, the Illinois resource list, there's a link to a presentation that IIR gave. It looks like it's to the Illinois OFR group. I think maybe this meeting. Uh, and I was curious, the link to that isn't working for me. And I can't tell if that's because IIR is not able to host it, or it looks like it's hosted by CDC Foundation. So Indira, it might be
Is
a
that
like
regarding red cap?
yeah, it is.
Okay.
One moment. It's titled. It is the one you have highlighted. Yeah, IDPH Illinois Joint County Red Cap Training Recording.
Okay. I think the problem is that it's linked to my CDC Foundation cloud, so I will create a separate link for that, and that should be fine then. So yeah, that was another joint county meeting that was recorded. I'll just make a YouTube link for that, and then it'll be fine.
Thank you very much.
Sure. Sure, no problem. I do also want to mention, if you did want to use RedCap later on, we are supposed to be getting our IDPH-based RedCap server. The data is already set up in there for the data fields at least, and we're just completed data entry testing. So now it's just a matter of setting up the data groups. So if you guys, we're also pushing the data user agreement through legal at the moment, so just waiting on that. But once that's ready and you guys can register for that, I'll send out a registration link if you guys are interested in using that, so you can sign up for that. The Illinois grantee meeting is also tomorrow, so I'm sure a ton of you are already aware of that, but just as a gentle reminder, that is tomorrow at 11. I think that's it for the updates on this side. I will be sending out a survey link as well with the follow-up email, just so that we can keep the topics fresh for the upcoming joint county meetings moving forward. So I'd love to get your opinion on that. So if you could just fill that out for me, that'd be great. Shouldn't be more than 5 minutes. So thank you. Michelle, do you guys have any updates on when Kane County is going to be holding their meeting, Sarah?
We are still waiting on legal as well.
I understand. Okay.
Yeah.
If there's anything we can help with from our side, please let me know.
We will. Thank you.
Okay, if there are no further questions, I don't want to hold anybody for their time, so I will let you guys go. All right. Thank you so much, everyone. Bye-bye.